Why are family health insurance premiums so expensive? Imagine trying to keep your family healthy while facing bills that seem to grow faster than your paycheck. That's the reality many families in America deal with when it comes to health insurance costs. Family health insurance premiums are high mainly because medical costs keep rising. Hospitals charge more for services like surgeries, tests, and stays. These increased charges are passed on to insurance companies, which then raise premiums to cover their expenses. Prescription drugs also play a big role. New medications, especially specialty drugs for conditions like cancer or rare diseases, can cost thousands of dollars per month. For example, some new diabetes medications or weight loss drugs like GLP-1 receptor agonists can cost over $2,000 a month, pushing up insurance costs for everyone. More people are using healthcare services now than in the past. Preventive care, routine checkups, and managing chronic illnesses like diabetes or asthma mean more visits and treatments. When more services are used, insurance companies have to pay out more, which leads to higher premiums. Inflation and wage growth also contribute. Over the last 5 years, family premiums have increased about 26%, roughly matching inflation and wage increases. This means families are paying more now than they did before, even as wages grow slowly. Employer plans often share costs with employees. As premiums rise, employers might increase deductibles or out-of-pocket expenses. Many families already face deductibles of $2,000 or more before insurance kicks in. This makes health care even more expensive when you need it most. Where you live matters too. Families in expensive cities or states often pay higher premiums. Older adults and families with more members usually face larger costs because they need more coverage. Income levels can also affect subsidies, which help lower-income families pay for insurance. For Asian American families, these costs can be especially challenging. Many work in sectors where employer insurance is common but still face high deductibles and premiums. Language barriers or limited access to culturally sensitive health care can lead to delayed care, which sometimes results in higher costs later. Knowing what drives these costs helps families make smarter choices. They can compare plans, look for subsidies, or choose higher deductibles to lower premiums. Understanding these factors makes it easier to find a plan that balances cost and coverage. In the end, rising healthcare prices, expensive drugs, more frequent use of services, and economic factors all push premiums higher. These trends affect all families, including Asian American families, who may need to be especially strategic about managing their healthcare costs.